We have all heard of environmental impacts on our health. We even see some, sensational stories in Hollywood movies. But the impact of the environment on health goes way beyond these, sensational stories. The World Health Organization estimates that 24% of all worldwide deaths are attributable to the environment. So, what modern tools can we use to make sense of our environment's impact on us for improved public health outcomes? Uh, AI, machine learning, and data fusion and manipulation with spatial techniques analyze and mitigate the impacts of environmental factors. These technologies can uncover patterns or make predictions for data-driven fact-based decisions when applied to accurate data. Pollutants like particulate matter, sand and dust in dry areas, carbon monoxide, nitrogen dioxide, contribute to respiratory and cardiovascular diseases, while water sources can cause gastrointestinal and neurological disorders. Chronic noise exposure, chemical pollutants, and biological agents pose various health risks, including hearing loss and infectious diseases. There's also, long-term radiation exposure. When you buy a house in the U.S., you commonly test for radon. And less obvious, poor housing and urban design influence everything from, mental health to physical activity levels. In addition, climate change exacerbates the risk of, extreme weather, amplifying many of these factors, increasing disease and contributing factor prevalence, and it even affects our food security. Understanding and managing these environmental factors and how they are intertwined, with our health are crucial for public health officials and policymakers to protect and improve community health outcomes. Our environment affects our health in so many ways. And in addition, our environment is constantly changing. The ancient Greek philosopher Heraclitus said, "No man ever steps foot in the same river twice, for it's not the same river, and he's not the same man." Sometimes he's also attributed to, with a quote, although perhaps incorrectly, that the one thing in life that is constant is change. Therefore, our environment dictates much of our health, but it is constantly changing, and we are constantly changing. Given the scope of the challenge, data easily outpaces human cognition. And these computational techniques can highlight primary locations exposed to environmental threats, predict new and changing threats, and uncover critical factors influencing these threats so that we can take action. So Benjamin Franklin said, when you're finished changing, you're finished. So taking a cue from Benjamin Franklin, let's talk about how our evolving technical landscape can help us adapt to environmental conditions for improved public health outcomes. In my 20 plus, year career, I've been really blessed to work with amazing people with diverse backgrounds. I've learned to apply cutting edge technologies to solve and understand real world challenges in public health, environment, crisis management, defense and intelligence, even crime prevention, just to name a few. So from my experience, I have a robust, I now have a robust interdisciplinary mindset and skill set that can help you solve your most pressing environmental and public health issues. The environmental effects on public health focuses on the interactions between the environment and human health, examining how natural and built environments affect well-being. It's crucial. It's a crucial aspect of public health and involves mitigating risks posed by environmental factors such as pollutants, chemicals, waste, and climate change. This field plays a pivotal role in promoting sustainable practices and policies that enhance air, water, and soil quality. Then ultimately protecting community health and ensuring the well-being of future generations. Earlier, I mentioned many of the environmental factors affecting our health. Many of these factors also indirectly influence our health by dictating our diet and exercise, and interactions with other people and wildlife, and its effect on our health, like we saw in the pandemic. AI and geospatial technologies combine computational intelligence and location-based data, location-based data fusion too, to enhance health applications by enabling the integration of diverse data sets, uncovering knowledge, and making predictions from some of these, massive data sets. Just some quick examples of applications include disease outbreak prediction, resource allocation and optimization, and improved healthcare accessibility. Two use cases. I use these technologies to fuse and process massive, remotely sensed environmental and demographic data to analyze and predict disease outbreaks on a continental scale, but while maintaining local district precision, in a collaboration with WHO. I also illustrated automated text classification of relevant news articles for WHO that, also would save them time. This work eases disease outbreak monitoring, allowing for quick action, response, and modeling for improved resource allocation. So if you feel you or your organization can benefit from AI and data analytics applications like those that I'm discussing in this video, please reach out, through a comment on this video, email, or any of my social media. I'll happily discuss with you consulting, training, and project development possibilities so we can transform public health together. As another application example, companies like Verisk and the publicly funded site riskfactor.com, use computational techniques to measure risk. They take diverse data sets, applying analytics and machine learning, and derive high-resolution risk measures in many locations. Their focus is environmental risk for property insurance. However, these same methods can be applied to health risks. In addition, I feel their next step should be environmental risk predictions to account for, like we talked about, our constantly changing environment. Public health organizations can effectively utilize AI for environmental health risk mitigation through several streamlined applications. First of all, risk mapping. AI analyzes data to map high-risk areas for pollution, contamination, and disease, enabling targeted interventions. Predictive modeling. AI forecasts environmental hazards using historical and real-time data, enabling timely warnings and proactive planning. Resource optimization. AI strategically allocates resources like health clinics and monitoring stations to maximize impact in high-risk areas. This application is especially vital in areas prone to natural disasters, like in areas that can be affected by tsunamis, hurricanes, and tornadoes. Monitoring and surveillance. Continuous AI-driven monitoring provides real-time surveillance of environmental health hazards, enhancing early warning systems. And finally, community engagement. AI identifies at-risk communities, supporting tailored public health communications and educational initiatives to increase resilience. These applications allow public health organizations to respond more effectively and preemptively to environmental health challenges. To reap the benefit of these computational methods, we need practical steps. Of course, we need practical steps to integrate them with public health planning and policymaking. So first of all, data integration and data integration in infrastructure. So collect and manage geospatial health data and build robust technological infrastructure for AI modeling. Then once you have that robust data, the AI modeling and visualization. So develop AI models to analyze spatial data and use visualization tools to present actionable insights. Education and training. We need to train public health officials and policymakers to use AI tools effectively, interpret the results clearly, and understand potential errors and biases. Next, policy development after this. Utilize AI outputs to create informed, data-driven public health policies. And then, of course, we need continuous evaluation and collaboration. which regularly assess the impact of implemented policies and encourage collaborative sharing of insights and improvements. The future advancements in AI are poised to significantly transform environmental health monitoring and interventions through various innovative ways. First of all, I mentioned this before, but advanced predictive analytics. As machine learning models become more sophisticated, AI could offer unprecedented predictive capabilities, forecasting environmental health risks like pollution levels, disease outbreaks, like I mentioned, I did for WHO, and the spread of allergens with greater accuracy and in real time. This would enable proactive interventions rather than reactive responses. IoT sensors, the integration with IoT sensors, integrating AI with IoT devices, provides real-time sensor data that could really revolutionize monitoring and provide this continuous, hyper-local, environmental data. For instance, sensors could detect pollutants or pathogens in the air or water, and AI analyzes the spatial and temporal data to pinpoint emerging health threats at a really granular level. Automated and dynamic response systems. AI could drive the automation of response mechanisms. For example, AI algorithms could automatically trigger air purifiers in areas where pollution exceeds safe levels, or adjust traffic flow to reduce vehicle emissions in congested areas, all based on real-time environmental monitoring data. I had previously mentioned, about some areas have a really robust things like tsunami warnings, hurricane warnings, but this can also be integrated for if a tsunami does hit, what's going to be the health repercussions of this? Enhanced multi-scale analysis. So future AI could perform complex analysis at multiple scales, from global all the way to local, enabling a holistic understanding of environmental health issues. I mentioned this with some of the work, initial work I did with WHO about making predictions for outbreaks, both on this massive continental scale, but while maintaining the local precision. Collaborative and open data platforms, developing more collaborative platforms that leverage AI could encourage sharing of environmental health data across borders. This is always an issue especially in the geospatial world, but a global network of shared insights would really enhance the ability to address transboundary environmental health risks. Especially Gen AI, I think, could really help with enabling better access to some of these collaborative data sets. All of these advancements suggest a future where environmental health and monitoring interventions are, more proactive, personalized, and precise, fundamentally changing how public health responses are formulated and implemented. Research and innovation in AI for sustaining and enhancing public health outcomes is really key. It's essential. Adaptation and accuracy. Continuous AI research adapts to changing environmental and health landscapes, improving the accuracy of predictive models for better disease outbreaks. Also, pollution level forecast. Big data management. Our data keeps getting bigger, so innovations in AI enhance the ability to efficiently process and analyze these vast, amounts of health and environmental data, leading to more actionable insights, and also separating a lot of the data noise from the really valuable information. Personalization and equity. Advances in AI enable, personalized health interventions and equitable resource distribution, by identifying individual risk profiles in underserved communities. And finally, research ensures a global collaboration. So ongoing innovation fosters this global collaboration and standardization in public health strategies, ensuring a unified response to worldwide health challenges. Personally, I'm committed to utilizing AI technology to enhance environmental health monitoring, improve predictive accuracy, and optimize intervention strategies. In addition, obviously, I want to spread awareness of the power of location-based data and analysis. In the end, my ultimate goal is to improve public health outcomes. I encourage public health professionals and organizations to adopt AI and geospatial technologies today to transform public health outcomes and build a healthier, more sustainable future. Environmental factors critically influence public health, and AI and geospatial technologies offer transformative potential to address these challenges by enabling precise monitoring, prediction, and targeted interventions. Embracing AI technologies is crucial for advancing environmental health analysis and intervention, providing precise data-driven insights for proactive and effective public health strategies. In conclusion, let's leverage AI as a strategic tool to enhance health outcomes and effectively combat environmental risks, ensuring a proactive approach to public health challenges. Thank you so much.